Hi, my name is Lara Barron. I'm the head of cardiology at Davies Vet Specialist, and I'm the course director for the Improved course for Advanced Cardiology. And I'm going to talk to you about how I approach an ECG. So I generally look at 6 different questions when I'm looking at a rhythm. The first would be, is it fast, slow, or appropriate? So is it a tachycardia, either ventricular or supraventricular, or a bradycardia, like a sinus dysfunction or an AV block? Next question would be, is it wide or is it narrow? And this is a really helpful one in determining both the origin of your arrhythmia and what treatment options might be best for it. So a narrow rhythm is going to be supraventricular in origin, meaning it's coming from the top of the heart. Doesn't necessarily mean the sinus node, but the top of the heart. Whereas a wide and bizarre rhythm usually is coming from the bottom of the heart, is ventricular in origin. Now, that could be a VPC, that could be ventricular tachycardia, that could be an escape beat. It just means it's coming from the bottom of the heart. Now, there is an exception here that I would mention, which is a sinus rhythm with a bundle branch block. You can also hear that called a sinus rhythm with aberrancy. And that's a sinus rhythm that has an abnormal conduction through the bottom of the heart, so it can kind of mimic a ventricular beat in its appearance. But most of the time, if it's narrow, it's going to be supraventricular, and if it's wide and bizarre, it's going to be coming from the bottom of the heart. Next 2 questions would be, is there a P for every QRS, and is there a QRS for every P? And this is really helpful in determining your AV blocks. So a normal rhythm should have a P for every QRS and a QRS for every P. But if you've got some disease there and a block there, then you might have Ps or QRSs without their corresponding partner. And so a little sub-question there is, the Ps and the QRSs, are they reasonably related? Do they tend to follow the same kind of pattern and have the same distance between them every single time? Because if they're all over the place, some are short, some are super long, then most likely those are happening at random and not reasonably related. The 5th question would be, is it regular or is it irregular? Now, regular doesn't mean normal, right? Because ventricular tachycardia is regular, a third-degree AV block with an escape rhythm can be regular. It just means that the beats are happening at a regular pace. Whereas an irregular rhythm can be either regularly irregular, like a sinus arrhythmia, in and in, out, 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 in and in, out, out, out. Or it can be irregularly irregular, like atrial fibrillation, bum, ba-dum, bum, 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 like shoes in the dryer. So if you kind of take a bird's eye view and you zoom out and you look at that strip, do you see a pattern there? If it's regularly irregular, then it's more likely to be a sinus arrhythmia. If it's all over the place, or if you can't find a pattern, then it might be atrial fibrillation or a different rhythm. And then the last question is it sustained or is it paroxysmal? So paroxysmal meaning it comes and goes. That can be helpful both in ruling things out. Again, atrial fibrillation most of the time tends to be sustained. So if you're seeing something that's happening intermittently, it's less likely to be atrial fibrillation versus some of our other arrhythmias. But some rhythms can be both. Ventricular tachycardia, for example, can be sustained. It's there until you do something about it, or it can be paroxysmal. It can come and go. And so in that situation, if you have a rhythm that you think might be paroxysmal, then, sometimes things like a Holter monitor, a 24-hour ECG, is going to be a better test than just listening for 3 minutes in consult, because you might miss it if it doesn't happen at that exact moment. So those are my tips for how I approach an ECG and kind of rule things in or out. Obviously, you heard a lot. Most of the time, usually, nothing in medicine is 100%, and there are lots of exceptions, but that's a good kind of framework to go by. And if you're interested in the exceptions, then, maybe I'll see you in the advanced cardiology course. But I hope that helps. And you can always ask your local cardiologist for advice when you've done the ECG if you get stuck. So good luck.